Hello and welcome to COVID Conversations here on WNCU 90.7 FM. Streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright. I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. We want to thank the African-American Task Force Plus of Durham for making this show possible. State health officials say it's no longer necessary for everyone to wear masks in public places to protect against COVID-19. And local government and school boards across North Carolina are dropping mask mandates. I've asked Dr. Christine Ibukun Kalu, the assistant professor of Pediatrics at Duke University, to come and be my guest to talk about what this means. Hello and welcome, doctor. How are you?
Thank you so much for the invitation. I'm doing well. How are you?
I'm so well, but I have so many concerns about COVID, and that's why I asked you to come and be with us today. And I want to start out with a statistic from the Department of Health and Human Services here in North Carolina. And in the past month, North Carolina has dropped from more than 15,000 cases of COVID a day to less than 2,000 a day on average. And that happened last week. Is 2,000 cases still a lot?
Depends on how you look at it. So that drop is massive and it's good. We're going in the right direction. A lot of times we look at cases as a proportion of our whole population in North Carolina. We're about 10 million. So seeing 2,000 cases a day in proportion seems like we're seeing a small number. And that's good. When you dig into the numbers, sometimes you might see smaller spikes in some age groups, but I think overall we're seeing lower cases. And the CDC has a good way to help us understand that metric using their county data tracker.
So is that something that you watch every day?
No. Maybe every week.
Maybe every week. Okay. So now that mask mandates are dropped and schools no longer require students to wear masks, what do you think researchers will use, or how will they measure outcomes about COVID spread rates?
Some outcomes will be more difficult to measure. So one of the key metrics has been how often are we seeing spread within schools? And it was a bit easier in universally masked schools to understand where an exposure happened, who was part of the exposed group, and how often did they get infected. But over time, we've adjusted what we're measuring. We've looked at changing quarantine measures. We've used things like test to stay, test to play, to better understand infection spread in schools. So as we go to a new era in schools where mask may be optional in some schools, we may still be able to track clusters. So how many people got sick or how many people got COVID and potentially spread, but it's just a little bit more difficult. Schools are really good at tracking things and following measures. So I trust that school leaders have some things already built in. So if they start to see patterns where, for example, half a class is out sick with something, I think that would raise a flag and can help with tracking.
So what is science saying about all this with the decrease and the effect on children?
Science is saying a lot. So first, the science has said it is always, so within schools, we've been able to reopen schools even when we saw high or low rates in the community. But with Omicron, we saw so many cases that a number of people actually caught COVID in school. And so just ensuring that if things start to get bad again, we're quickly able to revert back to things we know well. Wearing a mask, for example, doing tests as soon as you get sick, or just staying away from crowded settings when you're sick would be helpful. As to the impact on kids, it always takes us a little bit longer to learn about how children are handling anything, including COVID. So some of our more recent findings, which we should have been aware of all along, has been the huge mental impact, or the impact on mental health on children. and just trying to understand kids that have had mild infections but have long COVID or have something after COVID. What does that look like and how can we better help them? And this does not even start to address all of the losses that have happened with education. So kids that are falling back in math, science, social interaction, and just a bunch of other things. So we have a long way to go, particularly for our children.
So is it because that children don't communicate what they feel or how it's affecting them that you're having difficulty tracking what happens to them?
I think as a world, we often focus on where we have more people. So children represent a smaller group of individuals in any community in the US and the world. And resources shift first to adults before they get to kids. But I'm a pediatrician. We've been focused on kids the entire time. And kids have been adjusting to all of the things we've placed on them. It's just that we're starting to realize that they've borne a lot of the burden of the pandemic in quiet ways, and we can do better. We should have, and we can continue to do better by addressing their needs.
So what does dropping mask mandates do to the risk of people who've never gotten a dose of COVID-19 vaccine?
It depends. So the mask mandate by itself may not change too much. Community rates are going down, and that is a key factor to your risk of exposure. If you're in a community with zero COVID, then you may not be exposed to COVID. But if we see rates that are increasing, or we see circulating virus in our small community, and you don't have any buffer, you're not vaccinated, you've not been recently infected, and you're not wearing a mask, there's a high chance that unvaccinated people will not only get infected, but they had higher risk of severe disease. So ending up in the hospital or needing respiratory support, needing breathing support when they get sick.
So I want to go just a little bit deeper. Maybe if you have information specifically about African-American children or children of color and how they're faring in your estimation through this.
So children of color have had similar issues like I mentioned previously. One thing that has stuck out, and we as the collective, we pediatricians, people that have worked with or for children, have been collectively looking at, has been the increase in post-COVID syndromes in children that are Black and Hispanic. So what I mean by that specifically is there's this syndrome called multi-system inflammatory syndrome in children, where we see kids that may have had even mild COVID infections develop head-to-toe symptoms. They have headaches, they're vomiting, they have loose stools, their chest may hurt, they may have fevers, they may have a rash, they may have pain in their joints, and they come into the hospital and we need to manage them for a few days. It's called MISC for short. And that has consistently occurred more often in Black and Hispanic children. We're trying to understand why. It's not just because they were more likely to be infected. It seems to be this pattern that we need to address. That's one aspect of the disease. There's a lot of community issues. There's been loss of parents, loss of caregivers. There've been people have lost businesses through the pandemic. So there've been so many losses that children have had to suffer through, particularly Black and children of color in the United States. I don't have all the solutions. This is just, we need to ensure that there is awareness and ongoing resources poured into supporting them.
So what's your personal recommendation for mask wearing for children?
I'm okay supporting what has been pushed forth by the CDC and states, the health department. I'm also okay supporting local counties taking ownership of decisions within their school because they have a better sense of what the community needs might be, how much loss they've experienced, and how quickly they can start or stop masking in their school community. So what that might look like is you might go county to county and see different rules. And I think that's okay.
So there hasn't been a whole lot of information through the media as there was with COVID, with the variants. So how much of it is like really still out there? And then how concerned should people really be about it? You know, like stories do go through a news cycle a lot of the times, and then we tend to forget. So what about that? Is it still like lurking in the corner, waiting for an opportunity to grow?
Possibly. The way this virus, so it's called coronavirus because it looks like a crown, so it's a round virus. The way it infects us is we get exposed and it makes multiple copies very quickly. So it needs to multiply. So every time we have infections, we're giving the virus, this crown-looking virus, many more chances to create more crowns. Every time it does that, it may proofread the new creation or not. And if that proofreading mechanism doesn't work as well, we may get a new variant. Now, the variant may be worse off than the last one, such that it doesn't infect us as well, it doesn't spread as easily, or it may be the exact opposite, where it seems to be stronger, spreads faster, and causes worse disease. So as long as we continue to see infections and infections that spread from one person to the other, there's a chance that we may see more variants. As we have more people that historically have gotten vaccinated and are up to date, some people that have had, say, for example, they recently had Omicron, even if there's an Omicron subvariant, they may not get it again. So we just have fewer people that are going to get infected, and so fewer chances for the virus to create a new variant. That's just a long way of saying there may be variants out there. It should not have the exact same impact as all of the other ones we've seen, because we have more people that are now vaccinated and a few more people, particularly in the last month, that got infected.
So then what about the course, doctor, of people still going to get the vaccine? Is that still a recommendation? And then even for like the boosters?
Absolutely. Our goals with the vaccines have ebbed and flowed over the pandemic, and that's partially because the virus itself changed. Initially, the goal was zero infection, to get vaccinated to absolutely prevent infection. And while it does that to an extent, as the virus somewhat outsmarted our defenses, it became the core component of vaccination, which is prevent severe disease and don't die from this. And we've seen that hold steady all through the pandemic across all age groups. And so if you're unvaccinated, getting vaccinated at least allows you to mount a protection against the current variant today, but even future variants. And ensuring that you're up to date, and such as getting a booster, allows you to keep that protection going as the community rates change. And I don't want to forget our under fives. So we still have a group that don't even have a vaccine option yet. We have studies that are ongoing, and I'm hopeful that we would have a safe and effective option for them. They also get infected. They've also ended up in the hospital. They've also had to stop playing, go to daycare, not travel, all of those things. Some of them have lived through an entire pandemic. They're 2.5 years old and all they know is the pandemic. So I'm fully supportive of still getting vaccinated if you're not vaccinated.
Another question, doctor, we've heard the term long COVID. What does that mean?
It may not be the best term for this, but it's the one that we came up with. The medical community kind of came up with, and people that were experiencing it came up with this term. And what it means is, after an acute COVID infection, so for the most part, people get infected, they may have symptoms for 3 days, up to 10 days, maybe even 2 weeks, and they're fine. But then a smaller group of people either have the same symptoms for much longer. So they may not be able to smell or taste for weeks on end. We're talking 6 weeks, 8 weeks, sometimes 6 months. Some people have changes to their attention or the ability to focus on things. Some people have new things. Their joints ache, or they have odd symptoms with their nerves. or they're just not able to do what they could before. They could walk across a room and they can't do that anymore. Their lungs are not recovered. So it's a catch-all phrase. It could mean a bunch of different things, but oftentimes it starts off with a COVID infection and then leads to long-running symptoms. The virus is gone, but your body has been heavily impacted, and that has led to other things.
So it's getting warm, it's gonna get hot. And as warmer weather approaches, like what are some of the guidelines that you would give people so that they can maybe not be infected, or if they have been infected, not to be reinfected? What are some things that you can tell people?
Warmer is better. It allows us to go outdoors, and we know that being outdoors has been helpful in reducing spread. So go outdoors, be outdoors. We need to interact with people. It's been a struggle, and try and make sure your interactions are clean and safe. So what that might mean is if you are sick for any reason, we all need to take on that responsibility to stay away from others when we have something going on. It could be a quick vomiting, loose stools, could be quick runny nose, headache or something, but we need to do better about staying away from people when we're sick. Staying up to date on vaccines, which you talked about. If you're traveling somewhere, look at the CDC's website for their recommendations for travel vaccines. And don't forget to keep kids up to date on all the other vaccines that we have out there. So measles, influenza, we really don't want to see other things come back. Those will be my advice. And I hope at this point, everyone takes washing hands as part of their daily routine. Keep your hands clean, wash your hands before you eat, wash your hands when you come indoors after you've been out all day. And hopefully we can just kind of keep infections at bay.
Beautiful. Dr. Christine Ibukun Kalu is an assistant professor of pediatrics at Duke University. Thank you so much for your time today.
Thank you for having me.
Yes. And thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening on WNCU 90.7 FM. Be sure to like us. We want you to follow us. We want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host. Thank you so much for tuning in.